Welcome to the module on vital signs. This session focuses on human body temperature. Before we begin, let's quickly take a look at the key learning objectives. After completing this module, you will be able to explain what is temperature, explain all the factors that affect temperature, accurately measure oral, rectal, tympanic and axillary temperature, know the important guidelines while measuring temperature. Let's first understand what vital signs are. Vital signs are physical signs that indicate an individual is alive. They include pulse or heartbeat, respiration, blood pressure, temperature.
Let's find out when are vital signs measured. Click each tab to know more. When a person complains of not feeling well, when a patient is admitted to a hospital, several times a day for hospitalized patients, before and after surgery or some nursing procedures, before medications are given that affect respiratory or circulatory system. Let us now understand what temperature is. Body temperature indicates the level of heat in the body. Click each hotspot to know more. It is a balance between the amount of heat produced and the amount of heat lost. It is measured with the help of thermometer in degree centigrade or degree Fahrenheit.
The temperature measurement sites in a human body are the mouth, also known as the oral site, the rectum, which is called the rectal site, the axilla or the underarm is known as the axillary site, and the ear or the tympanic site. Most of the time, temperatures are taken orally. Rectal temperature measurements are the most accurate, whereas axillary temperature measurements are the least accurate. Sometimes, temperature is also measured at temporal site, that is the forehead. Now let's take a look at the table which shows the normal range of temperature at different sites on a Fahrenheit scale. At the oral site, the normal temperature is 98.6 degrees Fahrenheit, and it can lie in the range between 97.6 degrees to 99.6 degrees. Rectal normal temperature is found to be 99.6 degrees Fahrenheit, and it may vary from 98.6 degrees to 100.6 degrees Fahrenheit. At the axillary site, normal temperature is 97.6 degrees Fahrenheit, and it ranges from 96.6 degrees to 98.6 degrees Fahrenheit. At the tympanic site, normal human body temperature is found to be 98.6 degrees Fahrenheit, and at the temporal site, it is also 98.6 degrees Fahrenheit. Here are the factors that affect human body temperature. The factors are exercise, illness, age, time of day, medications, infection, emotions, hydration, clothing, and environmental temperature. The thermometer is a device used for measuring temperature. There are different types of thermometers.
Click each image to know more.
The glass thermometer is a small hollow glass tube that contains mercury or a mercury-free substance in a bulb at one end. When the glass tube is heated, the mercury rises in the tube and the temperature is registered in about 3 minutes. Electronic thermometers are battery operated. It has an oral probe and a rectal probe. While using an electronic thermometer, a disposable probe cover is placed on the probe. The temperature registers in about 30 seconds. Now let's take a look at a digital thermometer. This type of thermometer does not contain mercury. A disposable sheath is placed on the probe before using the digital thermometer in order to avoid infections. Digital thermometers are also battery operated. Temperature is registered often in a minute or less. Another type of thermometer is the tympanic thermometer, as shown in the figure. It measures the temperature in the tympanic membrane or eardrum. Tympanic thermometers are known to be fast and accurate. It takes only about 1 to 3 seconds to record a temperature. Now let's learn the steps to measure oral temperature.
Click each card for more information.
1. At first, rinse the thermometer with cold water. 2. Check the thermometer for breaks and chips. 3. Then place the thermometer under the person's tongue. 4. Leave the thermometer in place for 1 to 2 minutes. If the person has been eating, drinking or smoking, wait for 15 minutes before taking the temperature. 5. Record the reading on the thermometer. Here are some important guidelines regarding oral temperature measurement. Do not take an oral temperature on an infant or young child who is under the age of 6 years, an unconscious patient, a patient who has had oral surgery or has injury to the face, neck, nose or mouth, a person receiving oxygen, a patient with a nasogastric tube in place, a patient who is confused or restless, a patient who is paralyzed on one side of the body or has a history of seizures, a patient who breathes through the mouth. Now let's take a look at the steps to measure rectal temperature.
Click each term to know more.
1. Rinse the thermometer with cold water. 2. Lubricate the thermometer before inserting it into the rectum. 3. Place the person in a side-lying position. 5. Hold the thermometer in place for 2 minutes. 6. Read the thermometer and note the reading. Here are the guidelines regarding rectal temperature measurement. Do not take a rectal temperature on a person who has had rectal surgery or rectal injury, if the person has diarrhea, if the person is confused or agitated, if the person has heart disease. Always remember to complete your documentation after the procedure.
Let us now watch a video on measuring temperature. This video is brought to you by Vadvani Foundation. Items required: gloves, watch or clock, tympanic thermometer, regular thermometer and cold water. Measuring oral temperature. Wash your hands thoroughly with alcohol solution. Wear gloves. Rinse the thermometer with cold water and dry it. Check the thermometer for breaks and chips. Inform the patient about the procedure. Place it under the person's tongue and leave it for 2 or 3 minutes. Record the reading. Clean the thermometer and replace it in the case. Measuring rectal temperature. Wash your hands thoroughly with alcohol solution. Wear gloves. Lubricate the thermometer tube before inserting into the rectum. Insert the thermometer tube 1 inch into the rectum. Hold the tube in place for 2 minutes. Record the reading. Measuring auxiliary temperature. Wash your hands thoroughly with alcohol solution. Wear gloves. Take the thermometer out of the case and clean it. Make sure the underarm is clean and dry. Place thermometer in the pit of the arm. Hold the arm close to the body. Hold the thermometer in place while the temperature is being taken. Replace the thermometer in its case once the procedure is done. Record the reading.